So what's an assets approach? Well, an assets approach, firstly, has a long history. I don't want you to think that an assets approach is something I've just thought up or something that's just emerged recently. An assets approach has a history going back into the early 70s. Actually, some of the assets approach stuff predates a lot of what we do in public health at the moment. The first person who did work on an assets approach was a Jewish medical sociologist called Aaron Antonovsky. And if you want to read his work, it's absolutely fascinating. But he was very interested in what was called a salutogenic approach. Now, salutogenesis is the opposite of pathogenesis. Salutogenesis is the cause of good health. And if you want to puzzle a public health specialist, just trot out the word salutogenesis, because somewhere in the back of their training they'll have heard about it, but they'll have forgotten what it actually is. I'm just going to get a drink. And salutogenesis has developed over the last 40-odd years and has been contributed to by many, many people. And probably the two most important people who contributed to this approach in terms of community development were John McKnight and Jody Kretzmann at Northwestern University in Chicago. And they developed an approach called asset-based community development. Massive influence, actually, interesting, on Barack Obama. And Michelle Obama is still a member of the Asset-Based Community Development Institute. And if you read some of her stuff, it's very much about using this asset kind of approach. And this yes, we can stuff is very much an asset-based approach. Unfortunately, when poor old Barack got into power, he didn't find it easier to do the yes, as can stuff, I think, is when he was actually going for election. It's recently been contributed to by Anthony Morgan, who's an assistant director with NICE, and also by a guy called Erio Ziglio, who works for the World Health Organization, who started to use an asset-based approach in terms of how it might help us to challenge health inequalities. And it would be remiss of me at this stage to not mention big society. An asset approach is not big society, okay? And big society is not an asset approach. But I think there are some aspects of big society that would be delivered by adopting more of an asset-based approach. And finally, and I think the mantra for us all is, we should never do for a community what a community can do for itself. So here's the sort of things that we have. We have the kind of deficit-based thing, and we all recognize those. I bet some people in the room have got jobs that have got some of those words in their job title. And then on the other side, there's this map of what might start to be termed as assets, things that develop some of the things that Mike and Jude have both talked about in terms of connectivity, resilience. Aaron Antonovsky called it a sense of coherence. He said people who are healthy have a kind of internal sense of coherence. So the first thing I must say is I'm not suggesting abandoning a needs-based approach, right? What I'm saying is what we need to do is adjust the balance between a needs-based approach and an asset-based approach. And at the moment, my view is this is what the map looks like. I think we're far too on this side. I realize I should have done this map the other way around, because then I could have done right brain and left brain, couldn't I? Because kind of this is all right brain stuff, and sorry, that's all right brain stuff. And so I promise for the next presentation I will swap those around, and then I can do a bit on left brain and right brain, okay? What we want to do is move this to that. Wasn't that clever? Do you like that? That's good, isn't it? And again, I'm not suggesting going all the way along some of those pointers and that continuum. What I'm suggesting is redressing the balance between the two. So here's the dilemma. And this is going to give you a clue to a piece of work that I've done recently, okay? That people and communities do have deficiencies and needs, but also individuals and communities have assets and talents, okay? And probably the reason I'm here is because I recently co-authored a publication for local government improvement and development called A Glass Half Full. When I say co-authored, I worked with a colleague called Jane Foote who did all the writing, and I just had the ideas, which is the best kind of co-authoring that you can actually have. And you can see there is a reference to download the publication itself, okay? And the principles behind the publication are, it's in two parts. And the first part really looked at the principles of it and made the case for using an asset approach. And here are some of the definitions. And I'm not going to dwell on this because I think Mike and Jude actually have already covered this extremely well in some of their discussions as to what seems to make people healthier. It really does require a big change. Some people have said a paradigm shift is needed in terms of the way we think about services and the way we think about the way professionals act and what we do with and in communities, okay? And I think Mike's already covered this idea that we need to move away from what I would say were targeted interventions to a more proportionate universal approach. If you're going to work in and with a community, you need to work in the whole community. If you work in a whole community, that is a universal approach. I've heard people saying, we can actually work out the streets where health's the worst. Actually, we could probably work out the individual houses. What are you going to do? Knock on the door and tell them off? I sometimes suspect that's the plan. So here we are. This is what we're looking for. And this is the practice. Now, some of you will recognize this stuff. The other thing about asset-based approaches is it uses a series of techniques that we've been using for years and years and years. And anybody who's done any organizational development work or any leadership training will probably be able to tick off a few of those and say, yes, I know about that and I've done that. What I thought I'd do is just tell you a couple of ways before I finish as to where people have done this and what they've done, okay? Appreciative inquiry, many of you will have heard of that. It's an organizational development technique. What it says is organizations, communities and individuals will move in the way that they inquire. So if you look for good things, you'll find good things. If you look for negative things, you'll find negative things. But the very act of looking for good things moves you in a positive direction. Let me give you an example. Salford has used appreciative inquiry on some of the work it's done on high levels of smoking in some communities. And you know what they did? Instead of finding out where all the smokers were in a community and asking them how they could deliver better services for the smokers, they decided to go to the communities where they had the highest levels of smoking and find the people who didn't smoke and ask them what was good and positive about their lifestyles that meant they hadn't smoked in a community where there were very high levels of smoking. And then they're going to do more of that rather than do less of something else. Now, is that not just a really sensible idea? If you look at asset-based community development, South Ribble have done some of this work in this region. South Ribble did some work in a community where there was, I suppose, a contested green space, where there were a lot of young people who were getting up to behaviour that the adults didn't like, and where people had ideas that there should be gardens and perhaps a community allotment. And they used this community development technique to bring the whole community together. And interestingly, some of the conversations that happened, a PCSO said, I've never talked to young people like this before. The only time I've ever spoken to young people is to chase them away. Community asset mapping. Gateshead are doing some really interesting work on community asset mapping at the moment. That's actually looking at a community and trying to map the positives and the strengths in that community. And what they said, that in a particular community that we're working in, after about 6 months work in that community, somebody actually said, you know what, we've got an orchestra in this community. And I said, what do you mean? And he said, we've got an orchestra. This is one of the poorest communities in Gateshead, which is a poor place in itself. And in that community, there were people who could play various instruments, who could sing. And actually, they're genuinely now trying to bring these people together to create a community orchestra. I mean, isn't that fantastic? Some of the other things on there are some of the ways or the settings in which these things can play themselves out, okay? And I'm not going to dwell on them too much, but if anybody wants to speak to me, I'm staying for the rest of the day about how we might work something like an assets approach into work on resilience, or how we might think about mass localism, which is a way of approaching environmental issues as a whole community model. What I want to talk about, just to finish with, and I've got a couple of minutes left, okay, is the first is this concept of community asset mapping, because I think that's where a lot of people will start, okay? And in community asset mapping, what we actually go into a community and start to try and find out with that community, not for that community and at that community, but with and in that community, are the sort of actual and potential assets. And we talk about the assets of individuals, of associations and organizations. And we talk about the assets of the heart, the hand, and the head. So what do you feel, what do you know, and what can you do? And you can move on and actually apply this to communities in terms of things like physical assets, economic assets, and cultural assets as well. When you look at the assets, we're trying to determine whether these assets are primary assets, and I've kept the metaphor going for you, okay? Primary assets are what's in the community, controlled by the community. Secondary assets are assets that are outside of the community but are delivered to the community, which would respond to better community control and perhaps co-production models. And potential assets are assets that lie outside the community and are controlled outside the community but could be controlled inside the community. And what we know about asset development work is when you do this kind of work with communities, they get better at controlling those potential assets. The key about asset mapping is just finding out what the assets are is not the job. What's the key job is connecting the assets up. And it's interesting that in Jude's, whatever it was called, five ways to well-being, the first one is about connecting. So I'll leave you with this. This is whether we want to do things differently. This is whether you feel like there's a new policy. Jane and I are working on a second publication now. In the publication, we're going to try and develop and ask how we can develop and measure, perhaps, the work on community health and well-being. And my son, who's an engineer, suggested the title might be, Is the Glass Half Full or Is it Just Badly Engineered? And I think I'll leave you with that.
Great, thank you very much.